What I would like to do is define this angle and promenade it. So I would like to do her to have more of a, so most of my material will be going into this third. And what I'm going to do, my point of entry is going to be here, and I'm going to give in a threading technique with my cannula. Anatomy-wise, this angle has the masseteric muscle. The masseteric muscle is a very, very, very strong muscle. There is no way you will ever be able to go with a cannula underneath that muscle because it's wrapping the angle in a very, very strong way. So therefore, my plan is to place it just over the muscle and have a look and maybe do it on another layer more superficial. What material am I going to use? I need something strong. I need something that will give me support. I need something that's going to push everything outwards. Therefore, I'm going to use 40.
So you are going to use fortalis?
Yeah.
And you are going to use cannula? Or
yes, sir. Cannula.
Needle?
Cannula.
And what is your preferable choice? HA or non-HA filler?
Depending on the indication.
Depending on the indication.
So, for example, tear trough, temporal augmentation, lips, nose, definitely HA all the time. For jawline, I would probably sometimes consider non-HA fillers.
For the jawline?
For the jawline, yeah. When I want, depending on the patient as well.
Why you have said sometimes? Is there any specific indication?
Yes, because
or specific skin quality you want to know?
Yeah, let's put it this way. Non-HA is more expensive.
Okay.
So in order to have it, I need to have the full indications for it. So I want skin laxity, I want collagen stimulation, I want.
Okay.
If I put it for someone as young as Dr. here, she doesn't need rejuvenation.
Okay.
She could get away with volumization by using HYAMIRA 40. So I don't need to go make her pay so much money for an indication she doesn't need.
Okay.
But let's say I have someone who needs rejuvenation. Someone who is in their late 40s, 50s, 60s, who would benefit from that skin tightening and rejuvenation, who lost a little bit of elasticity, then I would consider non-HA if needed.
If needed. So it's very important. You have to select your patient, select the product. Don't suddenly jump any new thing that you are fascinated or you are convinced. Always select appropriate patient with appropriate. Yes, please.
This patient with the vision and all the
Okay, why not? Because the way this is one way of doing it, doing a bolus on bone. But another way is fanning it and spreading your filler all around rather than a bolus. With bolus techniques, the only place I use bolus techniques is the temporal and the chin. However, here I like drawing it. So it's just a technique I prefer doing. But as I said, if this is what you do, bolus, and it works nice, then by all means, I've seen bolus techniques with amazing results.
You don't do bolus on zygomatic?
No, what I do here, I give just along the zygoma. I go with a 22 cannula all the way up, and then I place my material just over the zygoma as I'm pulling out. So I create one tunnel and then go back and then create another tunnel.
Where is the entry point?
1 centimeter inferior to the lateral canthus. Because this point, this plane is a plane where I could use my cannula, go this way and this way without having to bend the cannula. So it's just at the two places that meet.
So basically it's personal choice. If you are comfortable with the needle, you can use needle. Dr. Shah, you are comfortable with the needle or cannula?
So again, it depends on the indication that usually I prefer on the bony regions, I prefer the needle. In the mid phase where I cannot see the bony support, I prefer the cannulas.
So it depends. So you are giving local anesthesia
Local anesthesia first. And I'm giving local anesthesia just to my point of entry.
So jawline is nowadays one of the popular demands in aspect of jawline. लेकिन हिस्सा तो बड़ा मजा आता है ना फेस एंगल तो हर पेशेंट जो आते हैं वो ये कहते हैं कि लेवल से 2 मिनट में करना है whenever you show them the camera yes in a minute they take some pattern oh and I think that will you just for the sake of discussion will you add something for her neck like HYAMIRA or some filler or thread, or just you think it's okay to use the HA filler to enhance?
Is it bothering you? Your neck? Then I wouldn't.
No, just for the sake of discussion.
If it was bothering her, then I would probably dissolve with lipolysis, Kybella, before doing anything. I think Kybella would do her very well. I don't think she will need lipo. I don't think she will need threads. Just a bit of Kybella will be fine.
Dermaster lipo. Dermaster lipo.
Dermaster also has a lipo injection?
Lipo injection.
What's the name?
Dermaster lipo.
Dermaster lipo.
Okay.
What's the price?
5,500.
5,500.
Open it.
क्या चाहिए?
So what I'm going to do, thank you. In this area, when I'm opening, I never go 90 degrees because I never go 90 degrees because there's the facial artery. I just go at 45 degrees, and remember, I just want to open it. Now, whenever I'm manipulating a cannula, I hold it very close, like a dart, and I start pushing it where I want it. My smart hand is going to be behind the angle, wrapped, to make sure my cannula doesn't go further back. This is stopping it. And then my other fingers are going to go under the angle. So now straight away I know where my filler is going to go, and I'm focusing where it needs to go. Now I'm going to start giving longitudinal. Very, very, very gently we give it.
Which side of facial artery you want?
Which side of the facial artery? The facial artery is here and travels this way, so I'm behind it. This is a 25 gauge cannula. Linear retrograde. Now, even if I try, this is the beauty of it. This is what I was saying. I'm going to try and push as hard as I can. Look how the cannula is stopping me. The fact that I'm using a 25 gauge, it's stopping me, the pressure is stopping me. So even if I become suddenly cocky and overconfident and I want to start giving more, this cannula is stopping me to do it.
I think main learning point of today is not be a cowboy. There are few cowboys over here, no three cowboys.
Okay.
About the
मसल के अंदर कैसे होता
Something to be afraid of in this region, especially.
Using a cannula.
So relatively safer area.
So here you get almost 0.8 mm.
I always leave about 0.2 to 0.3 for top-ups if needed. You see the angle forming now? So what we're going to do is we're going to sit her up once I'm done. Now what?
Yeah, now you can see it.
what I want you to do is I want you to sit up a little bit. So, get up. And I want you, this is the side we did. Yeah? Compared to the other side. You want to see yourself? Okay. She doesn't trust us. Okay. Are you happy with me now? Good. She threatened me before I started. Off camera. So always for jawlines, pick something. Pick a filler material that you could trust to give you the protrusion and give you a strong push outwards. That's why we went for 40 rather than soft. Soft I would use under the eye. I want something strong to push everything up. And once you try injecting it, you will understand how powerful this hyaluronic acid is by injecting it. You know, you all have experience and you've tried several, so you can tell straight away from the injecting technique what to expect and how flowy or how non-flowy it is. Can I have a new one, please?
What common complications you can have in this area?
The most common complication that you could get is when you're doing your opening, going through the facial artery, and blood will start pumping out. It does happen. Asymmetry, no one is symmetrical, my love. 100% symmetry does not exist. If you're placing the right amount on right and left, it should be fine. But if you get a measurement, yes, you might have a few millimeters. No.
Any chance of puncturing the parotid?
The parotid is quite far.
Okay.
But if you do it the wrong way, of course there is a chance. If I start going upward, start going deep, yes, there is a chance.
There is a chance.
There's always a chance of injuring. Even you could injure the external jug. You could injure the carotid if you place it the wrong way. So there's always a chance of injuring something if you are not at the right level, or if you're going very slow. If you're doing it in a very fast fashion.
So it means that anatomy is the basic thing.
Anatomy.
You must know the anatomy.
Yes. Okay.
Ji.
Do you treat the carotids with botulinum toxins? For example, how you do that? What is your same point or message or something?
Yes.
Just behind.
Yes. It has maximum. I think you have to start at 15 minutes on each day. Not more. Wait for time. I can see that you need a lot of force to push the.
Which is good.
This is good.
I like that.
It is a safety for the patient.
Because I wanted to finish quickly, I started pushing extra and it stopped me. That's why you saw. So it's good. That's a bonus when you have that. Congratulations on the new job. Thank you.
So you have used 2 cc of
In total, 1.6 because I left 0.2 and 0.2.
for each side.
For each side.
And it was